According to the CDC, about 1/3 of Americans will develop shingles at some point in their lifetime, and your risk increases drastically with age. Shingles can be extremely painful. So Dr. Christina Captain, the lead practitioner of the Sarasota Center for Acupuncture and Nutrition, is here to talk about some treatment options. This is kind of scary.
So scary.
I'm of the age where I'm starting to hear about this from friends. Let's talk about what it is. What is shingles?
So shingles is the virus called herpes zoster. It is a herpetic virus, right? So, and it comes from the same virus that causes chickenpox, herpes zoster.
Ah, well, okay, a lot of us had chickenpox as children. Mom, you purposely got me to have chickenpox as a child. I feel like my generation, that's how we got herd immunity, right?
Right.
So how is chickenpox tied to our risk of shingles later in life?
So if you've had chickenpox, what happens is this virus, herpes zoster, kind of lays into this nervous system, and it just never goes away.
From 40 plus years ago?
Yeah, from 40 plus years ago. So if you've had chickenpox, you are eligible, let's say, or more at risk to have shingles, or you will if you are exposed to that. Not really exposed, it's actually your immune system has to become weakened in some way, and you have to be under elevated stress, like huge stress. And so one day you might wake up and you have sort of a weird pain. Story happens all the time. People come into my office, I've got back pain, give me some acupuncture, help me. And I'm like, I open up, I look at the back and I'm like, oh, you have shingles. I look at that rash, I see right what it looks like. I said, that's a shingles rash. Let's get you to your primary care, your dermatologist, or urgent care, because we want to do an integrative treatment therapy plan.
Okay, so it's a combination plan, because I rarely hear you say, let's go first to an MD for some additional treatment.
Right, but we should, right?
Okay.
Because this is really important for you to get on an antiviral medication like acyclovir. You know, this is a really important thing, or valacyclovir, all the cyclovirs, right?
Got it.
So you get on that. Usually they'll give you something like gabapentin because they know the pain is going to be coming, because the herpes virus causes severe pain in the what we call dermatome, or nerve tract that it's on. The traditional presentation of herpes zoster is around the waist. That is very traditional, coming from the back part of the spine, in the mid-spine, the thoracic spine, right? The middle, not the low, not the upper. This is traditional, coming around to the front. And so the pain happens first, then the rash outbreak, and then then these little blisters that are filled with fluid.
Let's talk about the rash for a minute. And I know we have an image that I'll apologize because it isn't real pretty, but that's okay, because I feel like we need to recognize it.
Right.
So how can you tell if you have like a contact dermatitis or a heat rash versus a shingles rash?
It's really, that's dermatology in your primary care, and somebody just to see, somebody who's experienced looking at these skin rashes. I wouldn't advise a person just to do it on their own. Urgent care can tell you very easily.
Got it.
But it looks like a herpes outbreak. So if you already have a herpes virus in another way, you would know this is a herpes outbreak. You're going to have so much pain beforehand.
You're going to want some help.
You're going to want some help.
Got it.
Yeah.
So I like the multimodality approach that you're talking about, though. So we go to an MD, we get on these
on at least your antiviral. Some people will prescribe an antibiotic as well.
But it goes further than that, and that's where we need you again.
Right. So we want to see you. My office wants to see you within the first few days of the diagnosis, or that first week, because we're going to treat you. When I come in and I see that shingles rash, I'm going to treat you right then I'm going to send you off, right? Right. Or they come in a few days after they've got the diagnosis, and then they're on their drugs. Yes. They come in. If we see you in that first 7 days, the first week, we'll have you better in two more weeks.
So you can manage the pain.
We'll have you better. Your rash will be gone. They'll be dried up. Your pain will be gone. Everything will be fine, because it is misery. And then if you have the other atypical presentation, which is in the head, the one that can come up the neck and into the eye, that can cause blindness.
Okay, so this is important.
It's very important
on two levels, to get the drugs and get the treatment of the antiviral, but then to get the follow-up care. Is this through acupuncture? What do you do to help get it out?
Acupuncture resets the nerves, gets rid of the inflammation in the body from the virus.
Got it.
But here, and then we have herbs and supplements to help you carry on after your acyclovir, protocol prescription is over. But the biggest thing is this post-herpetic neuralgia. Neuralgia is, disorder of the nerve, or pain of the nerve, and then it comes from a herpes, right? So post-herpetic neuralgia. So after the virus is allegedly over, after the rash is dried, pain can continue. A traditional presentation of shingles lasts anywhere from 3 to 6 weeks.
We get it down to 2 weeks.
We get it down to 2 weeks.
Okay, good.
And then some people who wait forever to get treatment of any kind, they could have post-herpetic neuralgia for years. Significant, severe, detrimental, destroying your function of day-to-day life, pain every day.
So the takeaway I'm hearing from you is do not ignore a shingles diagnosis. You will need the medically prescribed antivirals, but then you also need this other modality of working through both the pain and the stress.
Yeah,
because I would be stressed with this diagnosis.
That's the thing. And headaches, you know, if it's been your headaches. We had a gentleman come in just, you know, last week, major shingles in through the head. Actually, he didn't know, and his wife was in for treatment, and she said, oh, he's got shingles. And I was like, oh my goodness, bring him in right away. It's only been 4 days. We get it done.
We can help.
At this time, he's only at 10 days, and he's out of pain. He has very little pain. So, and it's excruciating. You can't sleep, you can't think, you can't work. It's so worth it to come in and have care.
I have heard this description of pain from people who have suffered. It's so wonderful to know there are options. So for more information about a shingles diagnosis and ways Dr. Captain can help, or any other of your pain concerns, you can find Dr. Captain and her team by going to scansrq.com. We'll be right back.